Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. This program is providing information for you about healthcare matters relevant to you or your family members. We have healthcare professionals here to answer some of those questions. I hope you'll stay tuned and watch the rest of the show. We'll be right back after these messages. Welcome back to Your Health Matters. My guest today is Dr. Dennis Dunning. He's an interventional cardiologist here at KRMC. Thanks for being on the show today, Dr. Dunning.
Well, it's my pleasure, Jamie.
So you're an interventional cardiologist. We'll talk maybe a little bit more about that later on in the show, but what brought you to Kingman? How did you choose Kingman?
Well, it's a great medical community. I'm from Michigan. I've lived in Michigan my entire life, and our children have grown and moved out of the house, and my wife and I were looking around the country at places where we would like to retire to, with the intent of moving and finishing up practice in a place that we wouldn't move again from. So we looked in the south and southwest and came to Kingman, met the staff at the hospital, and toured the community, and this fit the bill.
Great. Well, we're blessed to have you here. It's exciting. And you've been here a few months now, right? So you come in
I
the
started
spring?
the 2nd of May, yes.
Okay, so you came in the spring. You've been through
Yes.
the hot of
So we've endured the warm,
Very good.
and that was nice, actually.
Yeah. Okay, good. And then like we were talking about before the show, that we'll have an easy winter where you can drive up and play, but it won't be as bad as it was in Michigan.
Right, nor as long.
Nor as long. That's the biggest thing, right? I know. So interventional cardiology, we talked about, that's a little different than regular cardiology. What does that mean?
It is. Cardiology is a discipline that treats, diagnoses conditions of the cardiovascular system. And there are general cardiologists, and then there are interventional cardiologists, and then there are electrophysiologists. So general cardiology deals with management and diagnosis of all the medically treated conditions that people have.
Okay.
Electrophysiology deals with the conduction system of the heart, the electrical component, and then I'm what some people refer to as a plumber. I deal with the blockages inside the cardiovascular system.
And that's kind of through the whole body almost.
Exactly, and historically it's meant and been more focused on the heart, but over the past 10 to 15 years, interventional cardiologists have reached out to other arterial beds, including the carotid arteries, the legs, more recently the venous system.
Okay.
And we've taken the techniques that were developed for the heart, primarily angioplasty and stenting, and expanded the application to a broader base of therapy.
Okay. So those other veins in the other parts of the body can still have blockages that can eventually cause problems for the heart, right?
Well, exactly, and that's the key thing, is understanding that atherosclerosis, which is the buildup of plaque and cholesterol inside of arteries, occurs everywhere in the body. It's the heart as well as all the other arterial systems. And the treatment is primarily medication first.
Okay.
Because we want to control the manageable components of that as best we can to prevent heart attack and stroke.
Okay.
In addition, people with blockages in their legs aren't always able to exercise like we'd like because of the pain that results from that. And so now that we're more aggressive about treating that condition, patients are less likely to require bypass in the legs than they were 10 or 15 years ago.
Sure. And it's kind of a compounding problem. Like you said, if your legs bother you, you can't exercise, you're going to gain weight, putting more pressure on your heart. Just kind of, it's a cyclical thing. So if you can catch it early. And speaking of catch it early, I want to show a video to our audience and to you that kind of talks about timing with our heart. Let's watch that together.
Okay.
Crushing chest pain. That's what most people think will happen if they have a heart attack, but that's not always the case. And because other symptoms can be very subtle, some people don't get to the hospital in time. Doctors at Mayo Clinic want to make sure you know the signs and symptoms of heart attack, so if you have one, you can get treatment fast. When it comes to heart attack, time is muscle.
If you have a blockage in your heart that's causing a decreased blood flow to part of the heart muscle, we've got to get you into the hospital quickly. Calling 911 is the best way to do that.
Chest pain coordinator Michelle Markham says the faster you get blocked arteries open, the less damage there's going to be to your heart. But the problem is many people don't recognize the signs and symptoms and don't get to the hospital soon enough. Most people think of heart attacks as causing crushing chest pain, and it's true, chest pain is a major symptom, but there are other more subtle signs too. Shortness of breath, intense sweating, pain that radiates to your jaw, down either arm or your back, nausea, vomiting, and dizziness. The feeling that something's not quite right.
And when I drove up, I felt not right.
Jim Couch had 2 heart attacks. He had chest pain the first time. The second one was different.
This time I didn't have the pain. It was just, I just couldn't get my breath.
But his wife called 911. An ambulance took Jim to the hospital where doctors performed angioplasty to open his blocked artery fast, well within the new national guidelines of 90 minutes from arrival at the hospital to time of treatment.
I've restored several old Volkswagens.
Jim's heart muscle recovered, and since he beat the clock and got prompt treatment, he's got the time and his heart healthy enough to work on his cars. In addition to recognizing the signs and symptoms of a heart attack, it's also important to know your risk factors and to try to live a heart-healthy lifestyle. For Medical Edge, I'm Vivian Williams.
So timing is everything, obviously. I mean, if you think you're having a heart attack, it's not one of those things you should maybe hang around and just watch and listen to, right? I mean, you want to get help right away.
Absolutely. And as mentioned in the video, time is muscle. And that's the message that we try to convey to all of our patients in the community at large, because many of the patients that have a heart attack have not had previous heart disease. And this may be a new thing for them. We're just trying to increase the awareness that when chest pressure, new shortness of breath, some kind of chest discomfort develops, it's imperative that you call 911.
Okay.
And I emphasize 911 rather than having a family member try to put you in the car and bring you to the hospital. If there's 911 available and the emergency systems respond very quickly, they begin treatment as soon as they arrive in your home.
So you're not waiting to get to the ER during that drive, you're actually being cared for.
Exactly.
Right? And that makes a big, because that sometimes you're actually having that heart attack right then.
Right, and there have been situations where family members were driving a loved one to the hospital and their heart stopped beating, and so 911 is important.
Absolutely, okay. So when we were talking earlier about the interventional, all of those procedures you're talking about, you can do right here at KRMC in our cath lab? Is that, you do the other procedures here
Yes,
as
they're
well?
done in the cath lab.
Okay.
It's the same cath lab team that works on the legs as work on the heart. And so
Okay.
they're experienced. They've been doing these procedures for many years here, and it's a very good cath lab here.
That's great.
The new thing that I bring is some of the venous work and the lower arterial work that hasn't been done quite as much here in the past.
So that's another opportunity. I love meeting and talking with our physicians as I learn more myself, but those are probably in the past situations where we would have had to ship people out, right? We'd have had to send them somewhere else because we didn't do them here.
Exactly, either Las Vegas or Phoenix
Right.
at some of the larger centers. But now I came from a large center, so I'm familiar with what happens there. And that was, going back to your original question, what brought me to Kingman. It was an opportunity for me to take that breadth of practice and experience and bring it to a smaller community where it hadn't been done before.
Wow. We're
So it's exciting for me.
Absolutely. Well, and for us too, we're blessed to have you here and being willing to share that with us. That's awesome. And it just extends the healthcare, broadens our healthcare that we have available for the community.
Right.
So, what kind of things, we talked about the plaque buildup, and I know diet plays a lot in that,
Right.
exercise obviously, but I think there's some things too, aren't they, that are genetic, kind of predisposed, I can't even say that,
Predisposition.
there you
yeah.
go, that's the word.
Exactly. There are certain factors, such as the way that your body metabolizes cholesterol, that is inherited.
Okay,
And what I always tell patients is you can't do anything about your genetics.
Right, right.
You have the family history you have, but there are a large number of things that are modifiable. And that's what we try to focus on, the things that you can change, and emphasize the importance in doing that, because you can override some of the genetic predispositions that you have and avoid a lot of disease such as heart attack and stroke.
by diet and exercise, and what else?
Exactly. It's a combination of diet, low fat, low cholesterol diet. Our society, unfortunately, has become less active, so
Right.
it's trying to emphasize physical activity on a daily basis, and then some of the other things such as smoking and some of the other high risk factor behaviors that, while not easy, can be controlled.
Right, and they all impact what's going on in those
It's
veins.
not a single thing, it's a combination of all of these different things.
Okay.
And we do know that diabetic patients have much higher incidence of both stroke, heart attack, chronic kidney disease, and so it's important to control diabetes, which is also a component of diet and exercise. So
Right.
everything is interrelated.
Right, yeah, our bodies are amazing machines that we have that how all interrelated, and how, like you said, that one thing will so totally impact other things as well. When someone comes in to have a procedure done, what kind of recovery are they looking at? Like if they have to have a stent done? Is it a-
It varies. There are a lot of different presentations.
Okay.
Someone comes in with a heart attack, as we saw in the video, then the length of stay depends upon what other problems they might develop while
Sure.
they're here, how
Okay.
severe the heart attack was. So that's more variable. What we call elective procedures, in other words, someone has chest pain, we know that they're at risk for having heart disease, so we do a stress test.
Okay.
We find the stress test is abnormal, then we bring them into the cath lab as outpatients.
Okay.
They're not having a heart attack.
Okay, let's hold that thought for just a second. We've got a couple of messages here, and we'll come back because I want to talk more about that.
Okay.
Stay tuned for the rest of the program. We'll be right back.